Ever hear about a virus that sounds, really specific, like it's stuck somewhere far off, something you don't really think about?
Mm-hmm.
What if one of those wasn't quite so isolated? And maybe, just maybe, its impact is bigger than we've been told, especially if you live in or, travel to those warm, rainy parts of the world.
That's exactly what we're diving into today. We're looking closely at the Oropouche virus.
Okay.
And we're mostly basing this on a really significant new study. It was just published in the Lancet Infectious Diseases by researchers over at Charité Universitätsmedizin Berlin.
Right, Charité in Berlin. So our goal today really is simple but pretty vital for you listening.
Yeah.
We want to really get a handle on how widespread this Oropouche virus might actually be, how serious it could be, and, well, what that means for you.
Yeah.
And straight away, the researchers found something that, honestly, it made me pause. This virus. It seems way more common across Latin America than we thought.
Way more common.
And climate looks like a big driver behind how it spreads.
Exactly. So this Oropouche virus, it was first spotted back in the 1950s in Latin America. And look, for a long time, people thought it was pretty rare.
Just a few cases here and there.
Right. Most countries might report, a handful of cases each year. It was sort of on the radar, but maybe not a top worry for public health folks usually.
But this new research, the one led by Professor Jan Felix Drexler at Charité, it paints a totally different picture, doesn't it? This wasn't just a quick look.
No, definitely not. It was really comprehensive. And Professor Drexler, he put it very clearly. He said, and this is really key, our data shows that Oropouche virus is massively underdiagnosed in Latin America.
Massively underdiagnosed. Wow.
Yeah. And get this, they found that in some places, at least 1 in every 10 people showed signs of having had it before.
1 in 10. Okay, that totally shifts the perspective on how common this thing is.
It really does.
Okay, let's dig in a bit. What does getting Oropouche actually look like? What are the symptoms people should maybe know about? And, how bad do we used to think it could get?
Well, the symptoms for Oropouche fever are pretty general, which is probably a big reason why it's been missed so often.
Right, like flu-like stuff.
Exactly. Think about the usual things when you feel run down. Fever, chills, headache, aches in your muscles and joints. Some people also get nausea, maybe a skin rash.
Okay.
So traditionally, the view was mostly, okay, it's a mild illness. Severe stuff like meningitis, that was thought to be quite rare.
But it sounds like maybe that view is changing a bit. I've seen reports recently of a big jump in cases.
That's a really important point. Since late 2023, the number of reported infections, well, it's shot up dramatically across Latin America and the Caribbean. We're talking over 20,000 cases.
20,000, that's huge.
It is, and what's really worrying are these recent reports of 2 deaths. Young women, otherwise healthy.
Oh, wow.
Yeah, so that makes you ask, is this virus always as mild as we thought?
And then there's this other concerning bit about potential risks during pregnancy.
Yeah.
That always gets your attention.
Yes, there are early signs, indications maybe, of a possible link between getting Oropouche while pregnant and negative outcomes. Things like miscarriage or malformations in the baby.
No.
Now, the researchers are careful here. They point out that, based on what we know so far, this seems less common than what we saw with Zika.
Okay, that's something, I guess.
Right. But it's absolutely an area that needs more research, and pretty urgently.
So this study, they looked at a whole load of blood samples, right?
Mm-hmm.
To figure out where the virus has been and how common it actually is. Can you walk us through that? How they do it, and what did they find geographically?
Sure. So the team analyzed, get this, over 9,400 blood samples.
Wow.
Yeah, collected between 2001 and 2022. And these came from 6 different countries: Bolivia, Brazil, Colombia, Costa Rica, Ecuador, and Peru. They were hunting for antibodies against the Oropouche virus.
Which tells you if someone's had it before.
Exactly. If you have the antibodies, you've been infected at some point. So across all these places, they found antibodies in roughly 6% of the samples overall.
6%. Okay, that might not sound massive on its own, but like Professor Drexler said, it still means a lot of people.
A huge number of people.
And I gather it wasn't spread evenly. Big differences between regions.
Absolutely. Costa Rica, for instance, had a lower average, around 2%. But then you look at Ecuador, it was higher, 5%. And the Amazon region, over 10% of samples showed a past infection.
Over 10% in the Amazon.
Yeah. And another interesting thing, people living at higher altitudes, they were less likely to have had it.
Huh. Altitude makes a difference.
Seems so. And because they had samples from different years, they could also see the infection rates kind of going up and down over time.
Right. So they built this detailed map of where it's been. But how did they connect that to why? what factors might be driving these infections.
Oh, right. This is where it gets pretty cool. They used machine learning. These really powerful statistical tools, basically, to crunch all the data. They looked for patterns, comparing the infection data with things like environmental factors, rainfall, temperature, and demographic info, too.
Trying to find the links.
Exactly. And their analysis pointed very strongly towards climatic conditions. Specifically, rainfall and steady, constant temperatures seem to be the biggest drivers of Oropouche infections.
So that links back to the recent surge in cases you mentioned. Professor Drexler talked about El Niño, right?
Yes, exactly. His hypothesis, his idea, is that weather patterns like El Niño, which mess with temperature and rainfall, might have basically created perfect conditions for the virus to spread more easily. It could be fueling this recent outbreak.
And crucially, it's not necessarily the virus changing, like mutating.
That's what the evidence suggests so far. They didn't find strong evidence that mutations in the virus itself were the main reason for the surge. It seems more environmental.
Which, thinking ahead, with climate change, that could have some pretty big implications, couldn't it?
Oh, absolutely. Professor Drexler specifically said he's concerned the virus could spread even more widely in the future as the climate changes. We might see more regions with those ideal, warm, rainy conditions for it.
And the study even created a risk map, which I found fascinating. Where does it suggest the highest risk areas are?
Right. The map basically pinpoints the Amazon rainforest as the main zone where the virus is circulating now.
Makes sense given the climate link.
But it also highlights high risk in other places, parts of Central America, the Caribbean, and also southern and coastal bits of Brazil.
Okay.
And an important note here, some of these places flagged as high risk haven't actually had official case reports yet. But environmentally, they tick all the boxes known to support outbreaks.
Right. So the potential is there even if it hasn't been formally spotted. This really underlines how this could be a much bigger deal than we thought. So how does it actually spread? And importantly, what can people actually do to protect themselves, especially if you live in or might travel to these areas?
Okay, so Professor Drexler made this really key point. He thinks Oropouche is probably right up there with dengue and chikungunya as one of the most common insect-borne viruses in Latin America.
Wow, alongside those big names.
Yeah. So the number one thing you can do is avoid getting bitten by insects.
Standard advice, but crucial here.
Absolutely. He recommends wearing long sleeves, long pants, and using good insect repellent. The ones containing DEET or icaridin are generally most effective.
Okay. And we usually hear about mosquito nets, but isn't this spread by something else, something smaller?
That's right. The main culprits here aren't mosquitoes, but tiny little biting midges. People often call them no-see-ums.
Those annoying things.
Exactly. And they are tiny, up to maybe 3 millimeters long. The problem is they can often get through the mesh of standard mosquito nets.
Oh, right. So a normal net might not cut it.
It might not. So if you're in a really high-risk zone, using finer mesh nets could be a good idea. And Professor Drexler also specifically advised pregnant women to talk to their doctor before traveling to regions where there are high infection rates right now, especially while we're still learning more about the potential effects on unborn babies.
Okay, really important advice for pregnant travelers. And just to be super clear, because people always ask, is there a vaccine? Is there a specific treatment?
Good question. Right now, unfortunately, no. There's no vaccine to prevent Oropouche infection.
Okay.
And there's no specific antiviral drug to treat the fever itself. Treatment is really just about managing the symptoms, rest, fluids, pain relief, that sort of thing.
Right, supportive care. So let's try and pull this all together. What are the absolute key takeaways you think listeners should get from this deep dive into the Oropouche research?
Okay, I think the main things are, first, this Oropouche virus is much more widespread, much more common than we realized.
Right, not so rare after all.
Definitely not. Second, it's potentially more dangerous than we thought, especially considering the recent surge and those concerning deaths. Third, climate, particularly warmth and rain, seems to be a really big factor in its spread. Think Latin America's warm, rainy zones.
Okay.
Fourth, there are emerging worries about risks during pregnancy, though maybe less frequent than Zika. It needs watching. And finally, because of all this, if you're in or traveling to these regions, protecting yourself from insect bites, those tiny no-see-ums, is absolutely critical.
Use repellent, wear long clothes, consider fine mesh nets.
Exactly.
And it really sounds like we need more research here.
Oh, absolutely. There's a definite need for more studies, especially to really nail down the risks during pregnancy and understand if there are any long-term health issues after infection.
This whole conversation, it really makes you think, doesn't it? When you consider how interconnected the world is now and these undeniable climate shifts, how should we, globally, be getting ready for other infectious diseases that might be flying under the radar right now in different places?
That's a really powerful question to leave people with.
It sort of forces you to consider the bigger picture, beyond just this one virus. What does this tell us about global health preparedness?
Yeah, I think understanding how these things emerge, how they spread, what drives them, like climate, like travel, it's just fundamental if we want to be prepared for whatever comes next.
And just as a final note, we mentioned the source was Charité. This research was actually part of the ZOE project, which gets funding from the European Commission.
Right.
Which kind of underlines the point, right? This takes international effort, international collaboration to track and tackle these potential health threats. Well, thanks for walking us through all that really important findings.
You're welcome. Glad we could dive into it.